Hello, I'm Dr. Deborah Bravoy with Anchored Hope Counseling. Welcome to our YouTube program, Hope Talks. We have some great content provided by our amazing counselors, and we hope that you find it helpful. Hello and welcome. I'm Dr. Deborah Bravoy with Anchored Hope Counseling. I'm here right now with Linda Howard, one of our licensed professional counselors. And we're just going to have a little conversation about clients that come in that have chronic illnesses. So chronic illness could be something that they're diagnosed with that it may be something they're living with the rest of their life, or it may be something just for a season. A lot of times it's cardiac issues. It could be cancer diagnosis, diabetes, fibromyalgia. We see more and more women coming in related to things that are connected to that. So 40% of Americans, which is about 133 million, are dealing with chronic illnesses. So we're seeing that more and more in the counseling session. So a lot of times they get, there's a stigma attached because they may look fine to everybody else, but they're dealing with a chronic illness. So they often get unsolicited pieces of advice or information about try this natural remedy or go to a chiropractor or things like that. But what are some things that family and loved ones can do that are supportive for people with a chronic illness?
Maybe just try to talk about just normal things, just talk about their life, how's the kids, what's going on. You might ask if they need anything, just in a kind of a nice, light way.
Yeah, so they don't just have to focus on the illness.
Themselves. Yeah. Not all focused on the illness. The things, maybe fun memories or things they used to do, or friends that they have in common.
Are there stories you've heard from people that have a chronic illness that just kind of make you cringe? It makes you kind of sad for them that that's their experience, that's what they have to deal with when they're living with a chronic illness?
Oh, sure. Yeah. And you just, have to have compassion, validate their feelings, maybe try to model remaining objective.
Having empathy.
Yes, have empathy.
Yeah.
Right.
One of my clients, it's been years, but she kind of talked about parking in a handicapped spot because she had a condition that really prevented her from walking a long time, and she didn't want to use the cart. So if I just run into Walmart and get a few items, I can do it without having to get the cart. That people kind of look at her funny when she would use that. But even just parking in a handicapped spot, that would make people judge her because she didn't look like she had an illness, but she very clearly, did.
Yeah.
And so when she came back out, somebody had left a note on her car that said, how dare you use up the space that somebody else could have used. And so that just really lends for their self-esteem, and kind of when depression symptoms kind of maybe set in. And that's really unfortunate. But with 40% of the population having a chronic illness, then it's something that we really need to kind of look at.
And that's a big thing that can be addressed in their therapy, is them trying to remain objective and understand how that they may be judged, that people may be just downright kind of mean, or kind of, and that they must be having some trouble themselves. To just learn to develop some of those skills in therapy through the long run, and accepting the changes, that they're having to live with.
Sometimes I have to help my clients educate those that are closer to them, maybe people they work with or family members, about what their limitations might be, so that there may be a little more understanding and empathy. I heard about this spoon theory, and it was really kind of enlightening. I've used it with some of my clients in the past, and I heard about it with, I can't remember who created it, but in dealing with somebody with fibromyalgia, for example, and their resources are limited, like physical resources. And so, like if you give a handful of spoons to somebody who is not hindered by any chronic illness, and have them provide a spoon for each activity or daily task that they do. So they may have getting out of bed, getting dressed, brushing their teeth, all of these, it seems really small kind of daily activities, but they all take a little bit of energy. And so the average person may have 25 or 30 or more even spoons or daily tasks, but somebody with fibromyalgia or even cardiac disease or some of these others, they have a limitation about how many that they would be able to use. So if they have 10, then you have to choose which 10 activities will you be able to engage in that day. Yeah. And that leaves a whole lot that's left undone. So sometimes people dealing with a chronic illness are labeled as lazy, or that they may be manipulating or unmotivated. They kind of may get some labels like that. If they apply for disability, sometimes people judge them for that, thinking, you look fine, you should be able to work. But if they use more than their 10 spoons and borrow from maybe the next day, then that leaves them depleted the next day, because they may not be able to even do the 10, the next day.
Yeah.
So that was really eye-opening for me when I learned about it.
Illustration.
Yeah.
Yeah, and that would be another thing, working in therapy, to accept that you're going to have days like that, and maybe learning to, in your conversation, to normalize and maybe if the person that's affected with it can just model the acceptance of, I accept these limitations, don't worry, because everybody always worry about, oh, did I say the wrong thing, or
I think acceptance is huge.
It is huge.
Because we keep hoping things will be different.
Yeah.
And then maybe having grace for themselves, just kind of allowing themselves not to have expectations that just aren't realistic or practical for where they're at in life.
Or where they're at maybe right now,
Right.
Yeah.
Yeah. So acceptance is huge. That's a big one. Validating, where they're at, and then allowing them kind of that space. Sometimes too, I found, and this is similar in grief work too, their loved ones are tired of hearing of their aches and pains.
Oh, yeah.
So they just bottle it up and keep it inside. And so just being that safe place for them to be able to keep having the conversations about what's going on with their body or what's going on with their illness. I think that's real powerful too.
It is so powerful. And to see the importance of including the therapy component in managing their illness.
So these are just things that we've been seeing in counseling, working with people with chronic illnesses. I think it's important too that we remember when they're given a diagnosis like that too. I think it's valuable for their physician, their primary doctor, an oncologist or cardiologist or neurologist, to make a referral for mental health services, because it is going to impact their mental health just as much as it is their physical health.
Yes. That it ends up being kind of working in a case management sort of, that there's going to be a lot of different components involved. And then, of course, it's up to the individual to sort all that out and put it together. And therapy can help with that too.
Yes. Thank you for joining us as we talked a little bit about chronic illnesses and how it impacts an individual, not just their physical health, but their emotional and mental well-being. Thank you for watching Hope Talks. We hope this information was beneficial for you. Please be sure to check out our other videos, and if you would please like the video and subscribe to our YouTube channel, we would really appreciate it. Thanks so much and have a blessed day.